Good evening, Heidi. So let's talk about what is being done in Gauteng. And I suppose the big news is the fact that we now need the help of the army medics.
Yes, certainly, Sally. And as I said earlier on to our colleague Tulas, it was an extremely important briefing that the acting health minister, Mamaloko Ngubane, held today, and hopefully we'll see more of that. But many people saying the granular detail is not there in terms of what exactly is going to be done, given the fact that Gauteng is, of course, having the most COVID-19 numbers. Most of them come from this province. But we understand that to assist the province, it seems as though the health facilities are there. They're trying to make means for beds, additional beds in the hospitals, but it seems as though they are short of staff to assist. And this is why the military health officials will be coming in to provide that necessary support. And this is going to be key in terms of trying to make sure that they have enough people in these health facilities, enough healthcare workers to assist. We've been hearing time and time again how there's a huge shortage of health personnel in hospitals, not just because of COVID-19, but there's an overall shortage. So this is hopefully going to make a significant difference. Also, what's key and what it seems as though the health department is trying to achieve is by mass testing. We do know that testing is certainly up in the last 2 to 3 weeks, but they are trying to, of course, increase that. And, of course, contact tracing, which is going to be key. What's also crucial here is that the variant that was first identified in India and the Alpha variant is not that dominant. It is the other variant that is, of course, still dominant in South Africa, and that is what's gripping the third wave. So some key information coming up, but what's key is the fact that they are trying to provide additional staff and personnel to assist with the third wave, especially in Gauteng, as we are seeing those alarming numbers. Let's listen to the acting health minister.
We've started to work together with the province. Yesterday, after the conversation with the President and the Minister of Defense and Military Veterans, we have requested additional capacity to assist Gauteng in terms of military help that has moved into the province to assist us swiftly. And I want to appreciate the Minister, together with the Defense Military Help, who have responded swiftly when we called them yesterday afternoon to say, please come and help us in Gauteng. What this will do will be able to release the capacity of the beds that have been held because there were no human capital. So they will assist us in terms of moving into the hospitals, into the areas where we need healthcare practitioners to assist us in managing, because in terms of the beds, you have to have the human capital that is linked together with the beds that we are making available for managing the pandemic. The second area they will intervene and assist us is around mass testing and mass screening in community, and also the contact tracing. They will be able to assist us in terms of that.
I mean, the numbers really are alarmingly high. In Gauteng, in one 24-hour period, over 7,500 new infections. In the country as a whole, it's sort of like just over 11 or just under 12,000 infections in that same period. So we have a big chunk of those new infections here in Gauteng. We know that 1,000 beds are being made available, but we also know that 4,740 people are currently hospitalized in this province with COVID or suspected COVID. So the need is there. It is growing. Heidi, did the acting health minister give any indication as to when the military personnel are going to be coming into the province to help?
So we don't have exact details on that, Sally, but one would imagine that it's going to be as soon as possible, given the stats that you have just given now. And even though, the health department has said that they are providing additional beds in the province, and when we asked the question about the field hospital, for example, in Nasrec, and why that's not going to be reopened, given the high volume of numbers we are experiencing in Gauteng? The answer was the fact that it was not being utilized and it was too expensive to keep open because it was not being utilized at the time. So it's going to be crucial for the Department of Health to keep an eye on that and to make sure that there are enough beds, because what we got on the ground yesterday when I was out and about, it seems as though public and private healthcare facilities are under severe pressure. So hopefully we'll get details as to when the military will be moving into the province, and of course if additional beds will be provided.
Yes, it is interesting because, as you're saying, what you're seeing on the ground, what we're being told, of course, by the authority is that Nasrec was decommissioned, but a lot of those beds and sort of equipment is now being set up, or has been set up at Chris Hani to deal with the extra need. Well, we'll wait and see on that. On the issue of vaccines, Heidi, so it seems that the doses for the teachers actually arrived late yesterday afternoon. So that really is good news, because the other area of great concern for Gauteng's parents is what's going on in our schools. Vaccinating the teachers is going to, I think, reassure a lot of people. Did you get more details on the teachers' rollout, but generally on where we are with vaccinations?
Yes, Sally, yesterday I told you that I'd be at the airport when those vaccines arrived, but it seems Department of Health beat me to it. But this is extremely good news, and I know there's been a lot of criticism and pressure on government to start vaccinating other sectors and not just those that are 60 and above. But it seems as though that is going to start as quick as next week, and we do know that the over 300,000 vaccines, Johnson & Johnson vaccines, is going to be specifically for the basic education sector. What's interesting here is that some have already been vaccinated, some are already 60 and above, or some were psychologists or social workers that were able to be vaccinated under the Sisonke trial as healthcare workers. So this is going to be key in terms of moving the vaccination program forward. And what we do know is that what's going to be interesting is that they're going to open up the sector. For example, the taxi sector, will specifically in Gauteng, will be vaccinated as of next week. And they're going to start moving into various workplaces, for example, mining and other key essential workplaces to start vaccinating. So we're going to see a significant ramp up as of next week, and as soon as those vaccines come in, and this is what we also got yesterday to say, the only issue was the fact that we didn't have those vaccines, but now that they're coming in next week, and we're going to be getting additional J&J and Pfizer, it's going to ramp up the vaccine rollout significantly. But let's listen to Nicholas Crisp, who is part of the Department of Health, on more details on the basic education sector vaccines and other sectors being vaccinated next week.
We are fortunately now received the 300,000 doses that we have been looking for bridging the J&J conundrum that we had when the FDA locked up vaccines. And we will immediately start rolling out 2 programs, and followed by others. The first one is the education sector. Altogether in that sector, there are 582,000 people. That's the public and the private basic education sector, including all those employed on Purcell, the SGBs, and the private educators. Many of these people have already been vaccinated, some because they're over 60 and some because they work as psychologists and others who are registered as healthcare workers. But the majority of people obviously still need to be vaccinated. The program is designed to, with a major thrust that should be over within 10 days, 10 working days, and all the provincial health departments and provincial education departments are going to focus on vaccinating educators in this period.
So, Heidi, I just want to pick up on what you said about other sectors coming on board. Is this regardless of age now? So we know that the teachers, regardless of age, are going to get vaccinated. You've spoken of mining, you've spoken of taxi. Are you saying that from next week, those sectors, regardless of age, are going to be added to the list of those who can get vaccinated?
Yes, and actually, while I was listening to Nicholas Cripps, I was reminded that it's going to also be police services, support staff in the police sector, as well as correctional services. And those who are on the government employees medical scheme are going to be assisted if they are on that medical scheme. They will take on that cost. So that's why I'm saying it's going to be ramped up significantly as of next week or in the next 10 days once the 300,000 teachers have been vaccinated, or those in the basic education sector. So this is why it's such important news that we're getting more vaccines, because it means they're going to start opening up more spheres and phases of the vaccine rollout. And this was initially the plan, but of course there were so many setbacks and delays because of what happened with Johnson & Johnson. So in the next 10 days, Sally, we'll definitely be seeing a lot more vaccines being rolled out across the country.
And it's interesting, Heidi, because we haven't even finished vaccinating all the healthcare workers. We haven't got anywhere close to vaccinating all the over 60s who want the jab. But it seems government is going, right, let's just get, as soon as the vaccines arrive, let's just get them out to all the sectors that we possibly can. It's really going to be interesting to see how this actually works come next week, when those 2 million Johnson & Johnson vaccines become available. It really is, and I think not a moment too soon if you consider what is happening in Gauteng, also with the Gauteng government saying we cannot shut down. We cannot shut down as a province because of what our numbers are doing. The only thing we have is vaccinations, and calling on people to please shelter in place, stay inside, don't go out. There's also been that call today in this media briefing. Tell us about that.
Yes, certainly. And just touching on your last point, Sally, if Gauteng is already opening up all public vaccination sites to those that are 60 and above, regardless of whether you have registered or not, as long as you have an identity book, that speaks to the fact that they are trying urgently to ramp up vaccine rollouts, because they're saying that they're not seeing the numbers that they thought they were going to see. There was that 5.5 million deadline for the end of June for those that are 60 and above. So they're obviously saying let's vaccinate as quickly as possible. But what's interesting here is also the fact that the acting Minister of Health pleading, and she reiterated this a number of times, saying that it's the responsibility of each individual to practice non-pharmaceutical measures. Do not go to crowded places. Adhere to the rules and regulations. Make sure you wear your mask. Sanitize as much as possible. If you don't need to go out, do not go out. And she also spoke to the fact that there are many illegal gatherings and protests that are happening within the province, which could possibly contribute to this. And she also threw a jab at some of the political parties that have come out to say they will not adhere to level 3 regulations, saying that that is irresponsible and we should all act in a responsible manner. And even though they're trying by all means to put those regulations in place, it is also the responsibility of a citizen to adhere to those. So those were some of the words from the acting minister, because the numbers in Gauteng are truly alarming.
Thank you so much, Heidi Jacques.